Hello, I am Dr. David Murray, Program Director for the Advanced Heart Failure and Transplant Fellowship Program at the University of Wisconsin School of Medicine and Public Health, located in Madison, Wisconsin. We appreciate that you are considering our program for training. We have an outstanding, diverse faculty who are vested in ensuring that you become a confident and competent advanced heart failure and transplant cardiologist. Madison is a progressive, dynamic city built on an isthmus, nestled between Lakes Monona and Mendota. Madison is renowned for its beautiful four-season scenery. Madison has 5 area lakes, over 260 parks, and over 120 miles of shared-use trails and paths. For those of you who are bike enthusiasts, these paths allow for unimpeded travel throughout the city and nearby areas. Our fellows train at both the University of Wisconsin Hospital and Clinics and the William S. Middleton Memorial Veterans Hospital. These facilities are literally connected with one another, thus facilitating clinical and academic collaboration. The University Hospital is a quaternary care center for the state of Wisconsin and surrounding areas. As such, we care for complex acute and chronically ill patients who require a higher level of care. We have strengths in interventional and structural cardiology with physicians capable of implanting percutaneous circulatory assist devices, managing patients with hemodynamically significant pulmonary embolism, and employing catheter-based interventions to treat valvular disease. Patients with sick hearts often have sick electrical systems. We are fortunate to have tight working relationships with our electrophysiologists and a superb multidisciplinary program to manage patients with refractory ventricular tachycardia. To support these programs, we have faculty with expertise in advanced imaging. The quality of our hospital and subspecialty care has been recognized with numerous awards. The William S. Middleton Memorial Veterans Hospital is a small hospital that does big things. We are one of 5 VA centers that perform heart transplants and one of 4 centers that implant left ventricular assist devices. In addition, our VA center performs lung and liver transplantation. Thus, we receive referrals from centers throughout the Midwest and sometimes beyond to care for veterans with complex end organ disease. In distinction to our university patient demographics, the VA population tends to be older, with more chronic and comorbid medical conditions. It takes a village to manage these complex patients. We have a multidisciplinary team inclusive of cardiologists, CT surgeons, nurse practitioners, nurse coordinators, social workers, health psychologists, nutritionists, palliative care physician, and fellows who work together to provide high-quality, comprehensive care. Historically, we have transplanted between 15 to 20 patients per year. In 2019 and 2020, we transplanted more than 40 patients per year. We are on pace to transplant over 40 patients again this year. Our post-transplant survival is excellent, exceeding the national norm for the era evaluated. For our combined UW and VA transplant program, we have a 75% survival at 5 years, 50% survival at 12 years, and 25% survival at 18 years. Previously, our LVAD program had implanted approximately 25 durable devices per year. With the change in the heart allocation system, donor allocation to recipients supported with percutaneous circulatory assist devices is prioritized, thus reducing the need to implant an LVAD as a bridge to heart transplant. Consequently, our LVAD volume has dropped to approximately 15 devices per year over the past 2 years. This decline in LVAD volume is comparable to other programs. Our post-LVAD survival at UW is similar to post-LVAD survival nationally. So what accounts for the dramatic rise in the number of heart transplants performed these past 3 years? There are many reasons. With the increased number of advanced heart failure transplant cardiologists at our program, we are receiving more referrals. Our surgeons are aggressive in procuring donor organs, and our program has been willing to transplant higher-risk patients. Changes in the heart allocation system has allowed us to transplant patients who otherwise may have died or required LVAD implantation to support the patient's circulation until a suitable donor organ became available. Lastly, our program accepts hepatitis C positive donors and donors after circulatory death, thus expanding the donor pool. What makes our training program special? First, we have an experienced faculty with diverse interests who are vested in fellowship education. Second, our fellows have a balanced inpatient and outpatient experience with an opportunity for research. Third, our fellows are exposed to a high but manageable volume of complex, diverse patients with unusual diseases and supported with all forms of mechanical circulatory assistance. Lastly, our fellows have the opportunity to rotate in specialty clinics such as pulmonary hypertension, cardio-oncology, congenital heart disease, palliative care, and infiltrative inflammatory cardiomyopathy. Our program offers flexibility during the outpatient rotations to allow trainees to specialize in a specific area. Recognizing that some fellows envision a career which may include imaging or diagnostic cardiac catheterization, in addition to the management of patients with advanced heart failure transplant, opportunity exists to spend time in the echo lab, MRI suite, or cath lab. Others may want dedicated research time or additional exposure to pulmonary hypertension, cardio-oncology, infiltrative inflammatory cardiomyopathy, or palliative care. Fellows spend 26 weeks on the multidisciplinary inpatient service, which includes consultation. Our advanced heart failure transplant fellows are assigned the more complex patients, as well as postoperative patients following transplant and LVAD. While on the inpatient service, fellows do not take night call, and they have one weekend day off per week. The outpatient rotations are divided between the UW and VA, though there is some overlap. Regardless of rotation, fellows spend Mondays and Wednesdays in the cath lab performing right heart catheterization and endomyocardial biopsy. Tuesday mornings are spent at the VA device clinic for the purpose of performing ICD interrogation and simple programming, an ACGME requirement. This clinic rotation becomes elective after the requisite 100 interrogations have been performed. Tuesday afternoons are spent at the UW Heart Failure Clinic and Thursday mornings at the UW Transplant LVAD Clinic. After fellows become proficient in right heart catheterization and endomyocardial biopsy, Wednesday afternoons are spent in the palliative care clinic. Friday mornings are devoted to either pulmonary hypertension clinic or cardio-oncology clinic. Again, this UW outpatient rotation is flexible and will be adapted to meet an individual fellow's training needs. The outpatient rotation at the VA is a little bit different. Again, fellows will spend Mondays and Wednesdays at the UW Cath Lab and Tuesday mornings in the VA device clinic. Thursday mornings are spent at the VA Transplant LVAD Clinic and Friday mornings with me at my UW outpatient clinic. The remainder of the time is spent performing VA inpatient consultation. As is the case with the UW outpatient rotation, the schedule will be adapted to meet an individual fellow's training needs. We have an advanced heart failure transplant didactic core curriculum, journal clubs, morbidity and mortality conference, pathology conference to review endomyocardial biopsy specimens, and cardiology grand rounds. Fellows are encouraged to attend general cardiology conferences that appeal to them. Our fellows are expected to present in academic grand rounds, case presentations, journal clubs, and morbidity and mortality conferences. Fellows meet with me on a quarterly basis to discuss programmatic issues with the intent of making adjustments as needed. To conclude, Madison is a beautiful city with multiple recreational and cultural opportunities. Madison has a young, highly educated demographic with the highest number of PhDs per capita and the third highest ratio of college graduates per capita. The University of Wisconsin-Madison is a highly reputable, large public institution recognized for its research productivity and innovation. Last and not least, for those of you who love college sports, we have the Badgers. Historically, our men's football and basketball and women's hockey and volleyball teams have been nationally ranked. Our fans are loyal and passionate. Thank you once again for considering our program. We hope to meet with you and learn about your interests and career goals. Feel free to contact me if you have any questions.